So again, thank you, Omari, for highlighting this HDTT, which is my most recent endeavor. It's crazy to me that the book and all of Project Unmasked was started about 4 years ago during 2020. And since then, obviously, a lot has changed. COVID has pretty much waned, but the movement to keep public health alive and public health education ongoing is definitely still very pertinent. And I think in high school I had a pretty narrow view of the world, and in public health, I think many high schoolers generally do. Uh, but it's as you get older, you definitely see more of the world and you see more of society and more of the things that you want to improve in the world. So after I went to college, I'm still, after I came to college, I began working as a nursing assistant at a local hospital. And I began pursuing a variety of other medical related extracurriculars that gave me a very firsthand insight into what the healthcare system looks like and how it functions on a day by day basis. And what genuinely could not escape me was the sheer amount of disparity that remains present in our health system. So many that, if you just Google like health disparities, you'll find disparities along socioeconomic lines, racial lines, ethnic lines, health literacy, educational level, country of origin. There's countless ways that disparities manifest in today's world, unfortunately. And to me, I felt like there wasn't enough that was being done to address these health disparities. Yes, there's been so many promising efforts, so much research has been put into this, but it's genuinely, in my opinion, not enough. I think a lot of the times research into health disparity is overshadowed by some other types of research that kind of comes to your mind immediately when you think of research. So like pipettes, TC hoods, which I love. I love wet lab research. I'm in a lab myself, but I think oftentimes we also need to pay attention to health disparities and how we can help improve health disparities by performing more data-driven analysis and research into these areas. And I noticed that many of my friends in college, they weren't necessarily being provided with as many research opportunities and advocacy opportunities to help reduce health disparities as they wanted or as I wanted to see within students. So I decided to put together this group where we could match students with mentors and students could work on their own health projects combating health disparities based on their own passions. So oftentimes students are drawn to a particular disparity because it very much speaks to their own identities. For example, if a student is from a marginalized community, they may be more interested in exploring disparities affecting their marginalized group that they belong to. Oftentimes, if a student has family members afflicted with a certain type of disease, like cancer, in my case, I am more interested in disparities that affect people with cancer. So what I wanted to do was to make sure that students are empowered to pursue exactly what draws them to this field of health disparities, and we can match them to the resources that they need to do this kind of research, and followed by advocacy of the results that they determine. So basically the workflow is that we have right now about 40 or so students from all across the country, actually hailing from 11 or 12 states, and we put them into groups to do research into areas that particularly interest them. So for example, we have projects looking into reducing racial biases in AI and radiology. We also have a project looking into rates of cancer screening among Asian Americans, especially Asian American immigrants, and why these screening rates for cancer are so low. We have another project looking into climate change health effects on undocumented children. So very, very, very niche topics that are often underexplored. So students work together in a group, they do a very, very thorough literature review, they put together a paper that then we use to match them with a mentor. And we have a pretty wide network of mentors from a variety of different hospitals, NGOs, universities, etc. And these mentors are super highly skilled in their fields, and we match them to the projects that we think best fit their expertise. And there is very open dialogue between the students and the mentors on how we can improve their existing project, potential methodology, ways that we can improve. And then ultimately the goal is to have a publication that can then be disseminated for the students into the broader literature. But we want to make sure that we don't stop there, since that's where most research stops, is that academics, they tend to sell the problem very well. They tend to have all these really great statistics that are very convincing that tell you this is what's going on and this is a problem. However, what's, I believe, more lacking in academia is, especially health disparities type of work, is ways that we can solve these issues. So we very much highly emphasize policy focused solutions that students can then propose to help reduce these health disparities that they just did all this hard work in identifying. And so every paper we require students to propose solutions, whether that be different community programs that can be implemented from a public health perspective, or policy solutions that can be implemented at the state, local, or national legislative levels. And we also have a network of policy advisors who hail from various elected positions or advocacy organizations or different NGOs as well. And we connect the students to these policy advisors so that they can deliver a presentation about the policy proposals that they would like to see passed, including, if they're talking to an elected official, different legislation that's currently being considered in the legislature that they would like to see them sign on to. This way, they can actually follow up their research with actionable policy advocacy, and so that they can play a role in helping to reduce these health disparities. And this is a very firm belief of mine as I was putting together this organization, is that students should have the entire experience from research to advocacy in order to ensure that what they're doing genuinely feels like they're making an impact, and that students do feel empowered to pursue exactly those disparities that they are driven to pursue, either whether it be based on personal interest or personal belonging in a particular minority group. So yeah, that's kind of the gist of the Health Disparities Think Tank and why we were formed and what we do on a day-to-day basis. Right now, we have 6 projects that are ongoing in our summer fellowship, and previously we had a couple more that explore things like drug prices, especially in cancer drug prices, and share decision-making strategies to help improve HIV patient care. So very broad range of projects, and we're always trying to recruit for more students, recruit for more mentors, recruit for more policy advisors, and this way we can really grow our network and our very unique model of making change.
Thank you for highlighting a lot of that. Before I dig into like more logistical questions of it, I think it's so important, and I wish there was an organization like this when I was in school where I can like contribute to research that interests me in a group manner, and also like have experience of like building out a research paper that has the ability to like apply to get into journals and those kinds of things. And I know that y'all are working on a journal as well internally,
Yeah.
and we'll talk about that in a bit. But I also like the point of like, let's not just research the issues, let's not just highlight the disparities and the data and what it says, but what are some of the solutions that we think can really be implemented. And oftentimes I think that is where public health fails in itself. It has the data, but it doesn't do much of the policy advocacy type work. It doesn't do too much of the implementation science and pushing into that work. So I think it's so important that we always frame not only like, hey, these are the health disparities, these are the things that are going on in community, but here are the solutions. And I'd imagine that as people continue to do this, we will get more refined solutions, we will get broader perspectives. And I think it's also important that we're having students give their perspectives on it as well, because it gives a fresh lens into a lot of issues that have essentially existed for decades in many circumstances. So I think like just having new ways to get perspectives on this research is helpful. And I'm very, very excited for the work that you all are doing. And like once again, I'm honored to be here and chat with you, because I think in the future you might be the Surgeon General for the US
Oh,
or something of that sort.
that's
So
so flattering.
it is true. It is true, and it is. I don't know. You embody a lot of things that I think a Surgeon General should have, and both on the clinical and on the public health perspective of things. So we'll see how your journey unfolds. But regardless, I think you're going to do amazing work.
Thank
Um,
you. That's so
you're,
kind.
you're most welcome.